Dr. Ravandi, does maintenance therapy have a role in AML?
Maintenance therapy is something that has been used in other leukemias for a long time and other types of cancer, particularly hematological cancers. In AML, it hasn't been normal practice traditionally, mainly because in AML, we haven't had many good, relatively non-toxic, easily taken drugs. So about 30 years ago, some groups, for example, a German group, actually tried to do maintenance with cycles of chemotherapy. And you can imagine if a patient is in remission and somebody says to you, I'm going to give you cycles of chemotherapy for the next 3 years, most patients wouldn't take it because they say, well, maybe I have 3 years to live. I want to go to Bahamas and be on the beach rather than getting cycles of chemotherapy. But over the last several years, there have been a number of effective, highly effective oral agents that have been developed, and one specific agent that has been developed for maintenance. Now, this specific agent is not curative. It's not that if you take it, you will live forever, but it does improve survival, and it's relatively well tolerated. And there are other clinical trials of maintenance agents are being developed, and I think it's a very important area in AML, and I think in the next several years, it will actually become common practice to do maintenance regimens.
Yeah, that's good news. So once an AML patient is in remission, how are they monitored?
So, I usually tell my patients that once you're in remission until something goes wrong with your blood counts. So it's not, in my opinion, it's not important to do, or definitely not important to do weekly blood counts, for example. Depending on patients' anxiety levels and comfort, we do check their labs maybe once a month, once every 2 or 3 months, depending on how far they are from their remission. In my opinion, routine bone marrows are not necessary during remission unless the patient is a part of a clinical trial that they have accepted to participate in, because we do get a lot of information by doing those bone marrows. So some studies have follow-up bone marrows, but that's really as a part of a clinical trial and to help further the knowledge in therapy.